Good afternoon. Thank you for joining us for the POLA 2 Advanced webinar. My name is Alex Dolezal, Team Leader Digital Health and Quality Improvement at Central and Eastern Sydney PHM. Before we begin, I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognize the continuing connection to land, water, and community, and pay respect to elders past, present, and emerging. I also extend that respect to Aboriginal and Torres Strait Islander peoples joining us today. Please note this event is being recorded. Please post your questions in the Q&A function. The evaluation survey will be emailed to you after the webinar. I will also post the link in the chat before we finish. We appreciate your feedback. Please complete this to allow us to issue certificates of attendance. Upcoming CPD events are listed on our website. The presenter for today's webinar is Diego Benitez, Service Desk Manager, Outcome Health. With a career spanning over 2 decades in IT, Diego joined the POLA support team in 2019. Now he's channeling his expertise into a new focus on training and education. Please welcome Diego.
Thanks. Thank you, Alex. Welcome everyone to this webinar. Now, today's webinar is on Guardian Analytics. So hopefully you attended last week's session, which was on the clinic summary report. Now, they're two completely different reports. The Guardian Analytics is more, you go in there for a specific purpose, whereas the clinic summary report, it's more of a fluid report. So it's basically, you look at all your data and you have a special interest, and it's a holistic approach to that report. So it's a lot more complex and extensive, so than the ones that we're going to be looking at. So I usually have Ben assisting me with the questions, but he's not able to make it today, so I'll be on my own. So I'll try and keep an eye on any questions, and please use the Q&A section to ask any questions, and I'll answer them as I see them. So we're going to be looking at 4 reports. First one being the Hospital Avoidance Tool, aka the HAT, the PIP QI report, the QIPC report, which is a quality improvement in primary care, and a Hep B and C report. Now they're a lot easier to use. Some of them are 1-pager, some of them are a couple of pages, and they're very, very, very self-explanatory. But I just thought I'd show you, and we go over these reports together. Now we're not going to go in this order. We're going to start with the QIPC, then we're going to do a segue into the PIP QI, then the Hospital Avoidance Tool, and we're going to end up with the Hep B and C. We've allocated an hour for these, but we should be able to fly through this as some of these are very, very small. So an hour should be more than enough. Wrong way. So quality improvement in primary care. So the POLA quality improvement in primary care QIPC report is a key feature of the POLA business intelligence tool, which is used by general practices. It helps clinics use the patient data to drive quality improvement and identify business opportunities. So we do use your data. This is for medical director, best practice, and SEDMED. And we de-identify it, we put all the smarts, send it back to you. It gets re-identified at the practice, and then you're able to look at your reporting. Now, it's at any best scenario, it's 24 hours old. So whatever you do today, it will show on your reports tomorrow. So yeah, the QIPC report helps the practice, the general practice, with the patient information to improve care quality. It allows practices to identify patient cohorts for targeted health initiatives, and we will go over these reports shortly, such as those with chronic diseases like diabetes, chronic disease, and a few others. The report helps the practice with the progress and the specific quality improvement, and helps the practice manage the patients more effectively. Then we're going to go into the PIPQI report. This is a 1-pager report, very straightforward, very simple. The report focuses on the 10 specific themes of quality improvements. Got a quick question. We are not integrated into Helix at the moment. That'll be a future functionality. So yeah, we look into the 10 QIMs that are part of the PIP QI program, and it helps you identify patients that are not meeting the criteria, and we'll show you how to do that shortly as well. I will be sharing these slides with you after for your reference as well. Then we've got the hospital avoidance tool, aka the HAT, which is a report designed to help practices manage the patients at risk of being admitted to hospital within the next 12 months. So we use your patient data to identify individuals. We use about 37, I think it's 37 different measures to calculate a risk, and then we break them down into high, medium, and low, and it assists you on how to prevent these patients from going to hospital, by suggesting health assessments and care plans and whatnot. And the last one is a hepatitis report. It's also a very simple one. It's a dedicated report within the Polar system that helps general practices manage patients with hepatitis B and C, or patients that may be at risk. Again, we'll go over these reports right now. So I know some of you may have Polar installed already or be in the process of getting that installed. If you need an installation of Polar, please liaise with Alex and his team, so we can organize an installation. The installation is very quick, takes about 10-15 minutes. There's no downtime to your clinical information system. And it's usually done with the help of your IT. So it's very seamless to you. You won't even notice it's done. And we can get you started in using these reports. Now, you can't really break these reports. They're read-only. We don't write back to your CIS. So if you do have access to these reports already, go in and have a look. You cannot break them. We're not a software. We don't install anything. The way you go is by navigating to polarexplorer.org.au. Once we create your practice, you will be emailed a login, and then you go and set your password so you can log in. And once you log in, you're able to create users for accounts for your practice users. But if you need assistance, please reach out to us so we can help you with the user creation. I'm going to log into here. Yours may look slightly different than mine. It all depends, what your PHN, Alex and his team want to communicate to you. Husky will be doing a webinar, Husky, at the end of the month on the 30th. Alex and his team will share the dates for other webinars as well. But what we're going to be looking at, we're going to reports and we go web reports. Now, again, yours may look a little bit different than mine. I just put on the reports here that we'll be looking at. So we're going to start with the QIPC report. I sure can make the screen bigger. Let me have a look. So my screen is actually very big, and maybe that's why it looks smaller. Just don't want to. Does that look better? I do have a very big screen, so let me see what I can do. Stop sharing. Share. Okay, that should be better. I'm only sharing the browser. Bring on my Q&A. Thank you. So once you log into the QIPC report, this is what it looks like. This is blank because it is a demo, but usually the PHN might want to pass on a message or have some activities for you to look at. There will be a display here. So that'll be for me to liaise with Alex and his team to make sure what they want display here so we can update it. Okay. Supposed to the clinic summary report, there's a lot less filters. As you can see, the clinic summary report's probably got about 100 filters. This is all the filters that you're going to get here. So you can select location if you have a multi-location site. Last activity period, whether you want 1 month up to outside of 12 months. If you want to have a specific chronic disease group, usual GP, gender, and age group. Okay, you may notice that this report looks a little bit different than the clinic summary report. If you had a look at that report, that's because this is using an older technology, which sort of looks a little bit dated, but we are migrating all these reports to the new technology, so it'll be it'll not only look nicer, it will be faster. So just bear that in mind. Okay, so we've got a few items, menu items here, just like the clinic summary report. Home will take you to this page. Then we've got patients, and then we'll have a breakdown of patients and a geography of patients, where your patient's coming from. We've got the clinical, we've got chronic kidney disease, cardiovascular disease, cancer screening, and we'll have a look at this in more depth as well. Diagnosis, diabetes, and data quality. Then we've got tracked MBS, which is very, very similar to the tracked MBS section in the clinic summary report. So I'm not going to go into too much into tracked MBS because it's basically the same report. Then we've got a share health summary section. And then we've got the PIP QI report, which is a good segue into this PIP QI report, as it would actually take you there. Okay, so if we go quickly into the breakdown, this will give you a breakdown of your patients. This is RSCGP active. And then it's average with the your PHN average. So it's you can see the blue line here. That's the average across the PHN. So it's benchmarked. And then we've got the sort of purplish line here that will show you how you're tracking against the rest of the practices. Then you can see here the age group by gender. So you've got female on the left, and right is the males and the percentage. And again, it's benchmarked against the practices with all the assessment practices. Then we've got a geography map, which basically tells you where your practice is located and where your patients are coming from. Cool. So now into the cool stuff, we go into the clinical. So we've got the chronic kidney disease. And I hope it doesn't look too small now. Let me know if it looks too small, and I can make that a little bit bigger. So again, there's 3 tabs for the chronic kidney disease, and it will be pretty much the same for the cardiovascular, I think, and diabetes as well. So it will tell you patients that already have a diagnosis, the ones that are indicated stage 1, stage 2, and so on. And then there's other cohorts. It also shows you there's no MAC diagnosis. Okay. And the, I can never pronounce this word, albuminuria stage, and it tells you what the count is. Okay. Then it shows you the at-risk cohort. Actually, might make it just a little bit smaller so you can see everything. You can see all your patients. You've got 10,000 patients. It will give you the age, the number of risk elements, in the last pathology that they've done. So you can do 3 months, 6 months, 12 months, or no filter. Whether indigenous status, a whole range of information there. So you can scroll across and have a look. Then you can highlight, single risk elements. So if you want diabetes, you can just click on those and then on that bar, and it will show you patients that have diabetes. You can go back and then show at what stage you're in. You quickly remove that filter by clicking on that. If you want to look at all your patients, then you can click on that as well, but it might be a bit irrelevant. You can have patients that have not been to your practice in a very, very long time. Okay, so we're going to turn that back on, and then we've got management. So the management is split into colors. Well, let me see if you can minimize those. So if you go 63, cool. So we're looking at the 63 patients that are have an active kidney disease diagnosis, and then it will show you what management you can do for them. And it goes, I believe it goes green is good, then you go yellow, orange, and red, and this will take you to the kidney.org.au website, and it's a management handbook. I won't click on it because this link is actually dated. In the production environment, I believe we have the up-to-date PDF, which basically will open up a PDF, and here it tells you anyone that's got yellow, basically go to page 31 and look at the yellow tab, and that would tell you the management. And then the same for orange, red, and so orange and red. So basically all these patients will tell you, okay, how can we manage Luis Cortez? And you go, it's got red. You open the PDF and it will give you a management plan. So that's pretty cool. Like I said, the production should have the correct link. This one is dated, and I have been asking for the devs to update it, but they haven't done it yet. Cool. Just keep looking at the questions. Now we're going to look at the cardiovascular disease, which is very similar as well. It shows you patients that are active. Very quickly click on those. And we can look at the management as well. And the pathology is very similar to the kidney one. We won't have any risk because obviously they're already active. Let me get rid of. I'm getting rid of that one. Cool. So if we get rid of the active, we can look at the at risk and management. I will tell you there's quite a lot of information that hasn't been recorded. They could potentially be have a chronic cardiovascular disease. So you can focus on the high ones, on the medium or the low. And there's some diagnoses here that you can filter in as well. So very similar. Again, this link, it is dated. It will take you to the rascp.org.au website, and it will give you a little bit more information on management plans for cardiovascular disease patients. Again, that should be updated on the live report. This is demo. It's all demo data. So it's a little bit older than the current one. Okay. Now, the cancer screening one, we've got 4 different screenings at the moment, which is the cervical screening, breast screening, bowel cancer screening, and skin cancer check. And then the sort of dashboard will give you a bit of a snapshot of, again, as to how you're doing in terms of screening, benchmark with the other practices in the Central Eastern Sydney catchment. There's more screening coming. So we've got lung cancer screening. The only reason we haven't really deployed is because the data that we're getting from the clinical information system it's not very good at the moment. So we need to wait for that data to start being better, for the lack of a better word. And it's all around the, I think it's PACs per year recording that we need to be able to give a more accurate screening. And also the next one is the prostate cancer that will be coming as well, but that will be next year. Okay, so if you got in this cervical screening, all the screenings will look very similar. Let it load, and this is what I mean with the old technology. The reports take a little bit longer to load than the clinic summary report. Cool. So we've got the urgency, and so we got the urgent cohort. We got patients that are due for screenings, patients that are not due for screening, and total due or not due. So you can, everything's clickable. You can click on the two. Taking a while. And it tells you what the who those two patients are, the risk level, when the last test was performed, and the last test result. For the Chiara, you can see it's intermediate, and for Alexandra, you can see that is low, and it tells you why and when the test was done. Cool. It's a little bit more information. If you scroll across, you can also, if you remove that, we can have a look at when the last test was performed. So if it's with the cervical, if you can go for any 5 years, so less than 5 years, more than 5 years, or they've never had one. But I assume they will be also highlighted when you do due for screening. Cool. And again, you can also highlight the risk. Anil, yeah, at the moment, no. These reports are only for the non-web versions. So we are going to be integrated into Helix, but not at this. It's not current at this stage. Okay. Moving to the breast screening, very similar as this cervical screening. You can see the last mammogram performed, breast cancer screening rates, and your patients, the urgent ones, due for screening and whatnot. Then we've got bowel cancer. And skin cancer. And you can go by your usual GP or Mossing clinician, or age group, and you can filter down into more manageable cohorts. And, again, you can also export patient lists for any of these. So if you click on the urgent for the bowel cancer, and you can go on your patient list, and then you can see who these patients are and whether you want to export these. You export it to Excel, and then you can either email them, have a bit of a call out for these patients. Hey, you're due for a screening, and you can send them SMS, email, or however you communicate with the patients. Every screen has a patient list here, which means any cohort of patients at any given time can be exported into a list. Cool. Now moving along, we've got diagnosis. Remove that. This is showing you diagnosis for those 31 patients. Remove that. There's the GP. Get a little bit more information. Yeah, so you can see that. So out of these 40,000 patients, you can see the percentage of cardiovascular disease, mental health, diabetes, cancer, etc. Same with the top 10 SNOMED prevalence. You can see all your figures for your practice. You can expand it if you like, and you can export it as well. This will export these figures. If you want to export those patients, if you want to export those patients, then you need to click on that. Okay, now that's highlighted 1,700 patients that are hypertensive disorder. And then you can go into your patient list and export those patients as well if you want to do further analysis. Okay, we're going to remove these. Then we've got diabetes, which is very similar to the other ones. I'm not going to go too much into this. And then your data quality. Loan, and it's just a chart. It gives you the smoking, the age criteria, The asterisk is, I think it's RSAGP compliance or specific. So they say it's for smoking, it's over 10, alcohol is over 15. That means that there's some filtering going on. If you want to know you've recorded, 83% of your patients, the PHN standard, it's 83, not standard, but benchmark is 83.1. If I want to click to see which patients are missing smoking recorded, you can just click on the blue. And then we got a patient list, and then you got all the whole patients of list of patients that are missing the quality status against them. Cool. You can do further analysis as to who is the most in clinician, and then you can see who's doing the most recording, less recording, and then you can assist your practitioners with where they are missing a lot of the information. For the data quality, we're going to remove that. And like I mentioned earlier, I click on this track MBS is very similar to the clinic summary report. It basically tells you MBS items eligibility. Again, the production one, I believe, has GP. I think this might be at the bottom actually. Yep. So GPCCMP, you can see who's eligible and who's partially claimed, who will be eligible for renewal. These will all be 0 to the about October, when it's been 3 months since it's started. So these numbers will start populating next month. And then you can see, eligible to action, fully claimed. Again, it's very, very similar to the one in the clinic summary report. The only differences is this is running on the old technology, and the other one is running on the new technology. We've got share health summary, which gives you uploads by provider, and uploads by chronic disease. So it tells you how your practitioners are doing for the quarter. Okay. If there's not any questions on this, we're going to move on to the PIP QI report, which is this last section here. Feel free to ask questions as we go along, and being mindful of time. Cool. So this is a one-page report. It basically assists you with your PIP QI figures. So it's basically 4 sections. We've got the QIMs up here. At the moment, we've got QIM 1, which is diabetes. We'll tell you here as well. Diabetes, type 1, with an HbA1c result recorded in the GP record within the previous 12 months. And we've got, there's a little bit of information. Anything that's got an I, it's got more information. Then it will tell you the numerator and the denominator. And then it's got a little bit of a click here to select patients. So if you look at that, it will tell you patients that have not do not meet the criteria. And again, we can see this 6, 7 patients here, and you can export those patients if you would like to do further analysis. Gives you an explanation here as to how we're calculating these figures. And you can also see at a glimpse trend as how your quality improvement is going over the last 12 months. So you can see for the screening, in this particular example, it's been on the incline, and for the BMI, from here, it's been on the decline. So it gives you a very good visual representation of how you're tracking. If you want to select smoking, you basically select the QIM on top. And again, you'll have the current smoker, ex-smoker, non-smoker, the smoker recorded. The calculation is the same as all the other reports, so you will get the same figures. Okay. So again, this is a one-page report, very straightforward, very useful. This report is available for everyone, whether you SEDMED, clinic, best practice, medical director, medtech, or if you do I believe a JSON upload is available as well to some degree. Cool. Moving on to the next report, which is the hospital avoidance tool, aka the HAT, and this is one of my favorite ones. It's been in the market for 9-10 years, so we've developed this about 19 years ago, and it's been improving ever since, with the latest version being released probably about a year or two ago. Like I said, it's got we use about 37 different data points to calculate to get to these figures. If you want a little bit more information, it's on the actual second tab. We didn't want to hit you with it every time you log on. So here are all the meshes that we use. So there's 37 ones, and you know what we're calculating. Okay, so I won't go through all of them. You can export them to have a look at it better rather than have a look at this report. And a little bit of information as well here. And we've got a little bit of a further information here for more information about how we calculate the deviation risk. Okay, and again, we also have on every page a data mapping for this page. So if we go here, if you go data mapping for this page, we will tell you on a knowledge-based system what we're calculating, how we're working this out, where we're getting the information from for us to calculate this. And this is particularly handy if you're doing data cleansing exercises or data quality exercises. I know BMI, I think in best practice, it's about 6 different places that you can put BMI in. If you go ahead and start increasing the BMI and you're not seeing those that being reflected in the reporting, it's probably worth checking where exactly we're extracting the data from, because you may be updating that information in somewhere that we're not looking at. Okay, so the hospital avoidance tool is the report that we use to assist you in, we show you patients that are likely to be admitted to hospital within the next 12 months. So what we want to do is we want to keep those patients away from hospital. And this is what we do, what we use to show you those patients. So we've got 278 that are urgent risk. So what we're going to do is we're going to do RSHP active. That goes down to 250, and when I click on those 250, I want to focus on those first. Okay, we'll focus on the urgent, then we go high risk, medium risk, and we may or may not look at the actual medium risk or low risk. But obviously urgent and high, we want to keep them away from hospital. And you can see here, Alex Turner, it's got a risk score of 31. Okay, so very high. If we put a mouse cursor over it, it will tell you why Alex got to 31 points, and it will show you it's got 0.5 points for smoking, 0.5 points for overweight, 5 points for chronic disease, active chronic disease, and whatnot. So you can see there's quite a lot of things going on there for Alex. You can see the age. Alex got 12 active diagnoses, and then you can have a look at there and what those diagnoses are. Yep. And we've got also current medications that Alex is taking. And you can see this, there's a bit more information there. So there's no ethnicity recorded, there's no indigenous status recorded, there's not patient status recorded. So the actual figure of 31 could be more, because there's some information that has not been recorded for Alexis. Okay, so that's great, but what can we do for Alexis? So that's where we go to available MBS services. And then it will show you a chart of what could potentially be done for these patients. So Alexis is obviously 53, so he's not eligible for any of these 75 plus health assessments, or 45 to 49. But Alexis hasn't had a heart health check. There's no care plan. There's no chronic disease nurse assessment. So there's there's quite a bit that could potentially be done. Diabetes checks is only done 3 out of 17. So we could, get Alexis back into the practice and do a bit of analysis to make sure that we can help them get better. Okay, it's the same for all the other patients. You might want to focus on a particular area, to be the GP, CMP, who's eligible for one of those, get them back into the practice and assist them and help them get better. Okay. But there's also patient quality information on the last tab. So let's click on that. And we can see that there's quite a bit of information that's also missing for Alexis. There's no waist circumference recorded, no ethnicity, no indigenous status. And you can see for other patients, Dakota, for example, there's no smoking, there's no alcohol, there's no BMI, no waist. So Dakota could potentially be have about 3 or 4 more points there if we have all of that information available. Okay, so that is in a nutshell what this report is about. You've got your home here. It will take you back here, and then we've got help again, which will show you. Let's see if quickly log on to that, and I'll show you. So this is basically, we're showing you this, and it's got a bit of it's a bit small, but it's got a bit of a rationale to show you there what we're working out, what algorithms we're using for each one, diagnosis, let's say active, I know that I'm just trying to look medications. In some cases it will show you patient ID. Sorry, this is what I'm looking for. So we show you where in each clinical system we're extracting the data from. So in this side, so MBS services, we're looking at patient ID, have a bit of a definition, and then from best practice, this is where we're getting the patient ID from. Okay, or if you use medical director, it's a little bit trickier. I believe that's changed actually. Or SedMed, this is where we're getting into patient ID from. Very, very good to look at the data mapping. I look at it all the time. There's no way I can remember where things are getting extracted from. So it's very good to get familiar with the data mapping. So if you do have access to a knowledge base, just go data. It's data mapping. It's one of these. I think that's the one. I have to find it. So here you got all the different tabs of where we're mapping, and I think there's 61 of them pages that we've got data mapping for. So very, very useful. I can't stress enough to use the knowledge base. Very powerful, and it's constantly getting updated. Okay, so this is it for the hospital avoidance tool. I'm going to go back to the reports, and we're going to look at the last one, which is the hepatitis report. Again, this is a very, very straightforward report. So we've got people with hepatitis B on the first hub, which we have 204. Give you a bit of information as to what they've got going, HPV, all those recordings. There we go, RSCGP active. If you want to see, that goes down to 82. Then we've got screening. Let's remove that. So from screening, you can see this is patients that are not being diagnosed, but you've got 152 that are high, medium flag, and low flag at 2,500, and it's 0 at high flag. So you might want to focus on these mediums and try and get them back to the practice for further assessments. and then this reporting. So you've got 75,000 patients like that. More on the active ones. And that goes back to this line. This is anyway, these are the ones that are prescribing. So we've got a dominator. So the dominator, which is this one, is all with the active or inactive hepatitis B diagnosis. And the numerator is patients with a current or non-current HBV medication prescription. So out of 173, we've got 6 that are prescribed, so it's 3%. So again, it's very straightforward. And then we've got the hepatitis B prevalence. Which is basically the same format. So the very straightforward report, very self-explanatory. Got the patients that have been diagnosed, patients that screening, and then we've got the reporting on those patients with hepatitis B. Hepatitis C is the same format. And then we've got the APRI. This gives you a bit of a chart, and it's how we get in these calculations, and we've got a link there to have a look, and then you can play around with these numbers. Very straightforward. Again, that's not my bank in this one. I have to make sure I fix that. Very straightforward report. Okay. So this is it for all the reporting. If there's any questions, I'm happy to answer them. If you don't have Polar installed yet, make sure that you liaise with Alex and the team to get Polar installed. If you have any questions, we do have a knowledge base section that has a lot of information. There's webinars, previous webinars, and a lot. And we've got walkthroughs on how to do things. So, like I said, make sure we get Polar installed first, and then you can start looking at your data. So, Alex, back to you.
Diego, thank you for your informative presentation. I have already pasted some links in the chat. So I have pasted a link for evaluation survey, but we will still email you the survey after this webinar, probably later this afternoon. Please complete the evaluation survey because we value your feedback, and it also allows us to issue the certificates of attendance. And I would like to also invite you to some upcoming webinars. So next Tuesday, the 30th of September, we do have a Polar Husky demo webinar. I've pasted the link in the chat. Polar Husky is an advanced appointment book tool and provides insight into your MBS claiming optimization, also improves communication. So that's for next Tuesday at midday. And I would also like to say that we are doing the repeat of this webinar and Polar One webinar in October. So if you've got any colleagues who are interested to attend, or you want to attend again, please check our website for dates. So thank you, Diego, and I hope to see some of you next Tuesday at midday for the Polar Husky webinar. Goodbye.
Yeah, it'd be good to get the Polar installed if it's not already installed, and have a play around, have a look around, and if you got any questions, attend the webinars again. We may be able to answer your questions live as well.
And for any inquiries, please contact us at digitalhealth@cespen.com.au. I'll type it in the chat. So it's digitalhealth@cespen.com.au. Thank you.
So if there's no further questions, I think Amelia, did I see you put your hand up and then you put it down? Did you have any questions, or it's been answered? Give it a minute. I just put those links. I can see that your links have been shared only. I'll put those links in the chat, Alex.
Thank you.
I think that was the first one you posted. The second one you posted. Sorry, that's my bad. I forgot to give you permissions to post to everyone. So you only posted to me. Cool. I'll just give it a minute for everyone to have a look at those links. So they're the links for the Husky demo webinar. It's a second link. The first link is the feedback, and then a bit of information on Husky, which is next week, and then your digitalhealthassessment.com.au email address for any questions. Cool. I will be emailing you these slides, Alex. So when you send your communication out to everyone, you can include them, and the recording should be available this afternoon.
Thank you.
Cool. If there's no more questions, thank you so much for to everyone for attending. If you've got any questions for me, please send them to Alex. Alex can send them to me, and we hope to see you using the Polar software. Thank you so much.
Everyone.
Thank you. Bye.